I am Callie Kennard. I'm your student nurse from UNKC, and I'm here to do a head-to-toe assessment on you. I'm going to wash my hands, put on my gloves, and I have a few questions for you, okay? So what is your name?
My name is Trine Nguyen,
What is your date of birth?
09/27/2001.
Do you have any allergies?
No allergies.
Do you know what month it is and what year?
It is November 2021.
Do you know who the president is?
Joe Biden.
Okay, so the patient is alert and oriented times 4. Your posture is straight, you have a good mood, and you seem to be positive about our head-to-toe assessment, if I can ever get these gloves on. Jeez Louise. Okay, so initially I'm going to get you to stand up for me, please. I'm going to check your skin. Your tone is tan, your skin is warm, it is moist, not too moist but not dry. We're going to get all the way down to your feet here. Okay, no lesions, no edema noted. We're also going to get back of your body here. Again, no lesions, no edema. Skin is moist but not too moist. And I'm going to test for your turgor here. You have good turgor. Let me do your hands too. Great turgor. Okay. So I'm going to move on to it. Push this up a little bit for you. Okay. Head is normocephalic, no lesions, bumps, or bruises noted. Your hair distribution is even. Put your head up. Your hair is straight and brown and, yes, evenly distributed throughout your head. So I'm going to move on to your face. Appears symmetric. If you could open up your eyes for me really big, close them, and try and open them. Okay. Can you puff your cheeks out for me? Can you smile, frown? So cranial nerve 7 is intact. Can you open and close your jaw for me? Okay, great. No pain or crepitus noted? Okay. And then can you try and open your jaw? Okay, cranial nerve 5 is intact there. I'm going to get your temporal arteries here. 2+ there. And 2+ there. Good. So now we can move on to your ears. Your eyes, actually, I'll do your eyes first while we're here. If you could close one eye or cover one eye, show me the lowest line, if you read it to me.
428739.
And then the other eye.
428739.
And then both eyes.
428739.
Great, that's 20/20 vision there. And can I have you, that means cranial nerve 2 is intact. Can I have you look up at the light so that light reflects equally on both corneas in the pupils there? And I'm going to have you follow my fingers. We're going to do the 6 cardinal positions of gaze, and this is how we're testing your extraocular muscles. Is there any pain?
No.
Great. So cranial nerves 3, 4, and 6 are intact. So looking at the external eye structure, again, it is symmetric. Your conjunctiva is pink and moist. Your sclera are white. I'm going to look at your corneas. Your irises are brown. Corneas are not cloudy and smooth. Same on the other side, not cloudy, smooth. Your pupils to me are a 4. Let's see what happens with some light. Yeah, those both went down to a 3 when they were dilated with some light. And then follow my finger for me. Cool, so your pupils are equal, round, reactive to light, and accommodation. So I'm now going to move on to your ears. So by the looks of it, they are symmetric. I don't see any redness or edema or lesions or anything of that nature. You have 2 piercings there, look to be healed pretty nicely. Is there any pain here when I push on your tragus?
No
What
pain.
about your auricle?
No pain.
And your auditory meatus, clear, no buildup of cerumen or anything, nothing obstructing. What about this tragus?
No pain.
And this auricle,
No pain.
and this auditory meatus is clear. And that's great. I'm gonna move on to a whisper test. We're gonna test cranial nerve 8 and test your hearing. If I can get you to stand over there, you're gonna push on your tragus, and I'm gonna say a combination of letters and numbers, and there are gonna be 3 of them, and then you're gonna repeat them back to me, okay?
2A5. 1A9.
Great, so cranial nerve 8 is intact with that hearing, that whisper test. Okay, so now let's move on to your nose, symmetric to your face, no lesions, nothing of note. By the looks of it, can I check your patency for me? Breathe in that. So a little congested maybe on that left nostril, but other than that, your nostrils are patent. And if you could look up for me, mucosa looks normal there. There's nothing obstructing the nostrils, and there's moisture in there. So I will now move on to your lips and mouth, and if I could, just by the looks of it, your lips are pink and moist. Can I see your teeth, please? Teeth are white and straight. Those gums going through those are pink. Great. Now, if you could open your mouth. The buccal mucosa is pink and moist. Let me push it down on your tongue. Say ah. Okay, so those tonsils are a 2+, and that uvula was rising and falling with phonation in its midline. So cranial nerves 9 and 10 are intact. And if I could get you to stick out your tongue, say light tight dynamite.
Light, tight dynamite.
Move your tongue side to side, up and down, all that. Great. So cranial nerve 12 is intact. Okay. So I'm going to press it down. We are going to move on to your neck, throat, and that. So I'm going to palpate some of your lymph nodes. I'm going to start with your preauricular, postauricular, occipital, submental, submandibular, jugular-digastric, superficial cervical, that deep cervical chain, posterior cervical, and supraclavicular. Those were discrete. I didn't feel them, to be quite honest. So I'm going to move on to your thyroid. Take a swallow for me. No pain there, right? Freely movable, no inflammation. Now I'm going to do range of motion for your shoulders. So if I could get you your neck first, side to side, up, down, all around. Now shoulders up, down, front, back. Push up against me. Push here, push here. Great. So cranial nerve 11 is intact. So now we will move on to your lungs. So I'm initially going to have you raise your arms here. We're not barrel chested, which is great. I'm going to have you face this way. I'm going to do symmetric, see if you have symmetric expansion, so breathe in for me. So those thumbs moved out symmetrically. So there is symmetric expansion. So with each of these times I touch your back with the diaphragm, if you could breathe in and out for me, okay? Okay, so these are the bronchiovesiculars and these are the vesiculars, and there were no adventitious sounds, no crackles or wheezes. So now we're going to go around to the front here. Same thing applies. Okay, so these are the bronchioles, these are the bronchiovesiculars, and these are the vesiculars. And there were no adventitious sounds, no crackles or wheezes. So now I'm gonna move on to your heart and lungs, excuse me, your heart and neck muscles. And I'm going to I'm gonna do your aortic and pulmonic, I'm gonna listen there. So I'm gonna do bend over, and you're gonna exhale for me, and you're gonna hold it so I can listen to them, okay? So there are no murmurs noted there. I'm going to palpate your carotid arteries one at a time. Oh yeah, that's a 2+. And that's a 2+ bilaterally. I'm going to listen with the bell of my stethoscope for carotid breeze, okay? No breweries were noted there. So I'm going to get your radial pulses right now. So if you could. Okay, so that was your right radial pulse is 64, it's regular, 64 beats per minute, it's regular, and it was a 2+. So now I'm going to do your left. Okay, so your left radial pulse was also 64 beats per minute, it was 2+ as well, and it was regular. So I am going to listen to a few places of your heart with both my diaphragm and my bell. This is the aortic, this is a pulmonic, this is Erb's point, this is tricuspid, and this is mitral, and I'll be listening to all of those. Okay, so there were no murmurs noted. This is the apex of your heart, and this is the base of your heart. S1 was loudest at the apex, and S2 was loudest at the base. Now I'm going to get an epical pulse for 60 seconds. Okay, that was 74 beats per minute, and it was pretty regular. Now I'm going to re-listen to the parts of your heart with the bell of the stethoscope. Alright, Alright, so no bruise or noted there. So now we're gonna move on to your abdomen, so if I could get you to lay down for me. Yeah, I have to move this. Okay, so flat symmetrical contour, the umbilicus is inverted, no piercings noted. Initially I'm going to oscillate in all four quadrants. We have the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. I'm going to go in that order through the diaphragm. Normal vowel sounds were heard in all four quadrants. I'm just going to transition on to, with the bell of my stethoscope, listening to your abdominal and renal arteries for bruise. We have the two renals and the abdominal. No bruise or noted there. Now I'm going to percuss in all four quadrants. General tympany is heard in all four quadrants. Now I'm going to palpate light in all four quadrants and then deep, and you tell me if there's any pain, okay?
Okay.
No pain?
No pain.
A little bit deeper here.
No pain.
No pain there?
No pain.
Okay. So I'm gonna have you breathe out for me. Like breathe in and breathe out so I can palpate for this liver here. The liver is not felt. I'm going to do your spleen. The spleen is not felt there. And now I'm going to start with this side for the kidneys. Breathe in and out. Kidneys are not felt on that side. I'll be doing the same thing on the other side. In and out. And the kidney is not felt on that side. So if you could sit up, I'm going to briefly talk about your legs. We have looked at your legs in the lower extremities. So there was no edema noted, no lesions, skin was warm, dry, and nothing of note. So I'm going to get your dorsalis pedis, that's 2+ there, on the other side, additionally 2+, and now your posterior tibial, 2+, and 2+ there. Okay, so I'm going to get you to stand up now. We're going to go through some range of motion work. So if you can just follow me. Cool, okay, so I'm going to have you put your shoulders up, down, back, around, and we did the strength for your shoulders. Now I'm going to move to your biceps. We could flex, extend, push, pull. Great job. Let's move to your fingers. Let me see you touch all your fingers. Move your wrists around, side to side, up, down, all that. If you could grip with me, can you push? Can you pull? Good. Now we're going to move to your hips. So if you can hold on, go up, in, out, around, back, and push, and push, and I'll do that on the other side. Around, push, pull. Great. Okay, now remove your knee, so it's just that hinging motion there. Push, pull, and on the other side. That. Good. And good. Now let's go to your ankles and your feet. So down, up, side, side, inversion, inversion. And then push down, push up. Now on the other side, same thing. Around, inversion, inversion, everything. Yep. Push up, pull down. Great. So now we're going to move to cerebellar function here, and you're going to close your eyes, and you're going to tell me when you feel the cotton ball, okay?
Feel it. Feel it. Feel it. Feel it. Feel it. I feel it. Feel it. Feel it. Feel it. Feel it. Feel it. I feel it. I feel it.
Good job. So if you could follow me, close your eyes. Great job. Rapid alternating movements, please. On your heel down your shin. Great job. Let's do a Romberg test while we're here. Close your quads, good job. Okay, there was no movement there, so now we're gonna get some reflexes from you. You can stay standing for this. I would say those are 2+ responses. I'm gonna do your triceps. If you could do a ragdoll for me. 2+. 2+. Now, if you could here. Okay, brachioradialis. 2+ there. 2+ on this side. Now you can sit down and I can do your patellar. 2+. 2+, and let's do your Achilles. 2+. 2+. Okay, let's get up and do your spine. Before we finish, if you could bend down for me. There we go. Feel your spine, it's midline. Can you stand up for me? Can you go side to side? Yeah, give me good twists, and then side to side. Okay. Well, thank you for being my patient today.
Thank you.